The use of smoked commercial tobacco products in Indigenous North Americans is the highest among all ethnic subgroups in the United States. After reviewing over 13 years of data from Olmsted County, Minnesota, we determined that although the Indigenous cohort was more likely to smoke compared to the non-Indigenous cohort, Indigenous people were more likely to quit smoking and more likely to use pharmaceutical cessation aids to quit smoking. The key smoking behaviors we identified influencing smoking prevalence was smoking relapse after more than a year of smoking cessation. Smoking relapse was more than 3 times higher in the Indigenous cohort than the non-Indigenous cohort. Oki, nitaniku asta ahaki. Hello, my name is Dr. Annie Rusk. I'm a pulmonary and critical care medicine fellow on Dakota land at the Mayo Clinic Rochester campus and an enrolled member of the Blackfeet Nation. It is my privilege to discuss our study, Indigenous Smoking Behaviors in Olmsted County, Minnesota, which will be published in the Mayo Clinic Proceedings. Understanding smoking behaviors among Indigenous North Americans is critical to create prospective, evidence-based interventions to address smoking prevalence. Smoking prevalence in this group is the highest among all United States ethnic groups, estimated to be over 30% among all adults. There are over 9 million people representing 574 federally recognized tribes who identify as American Indian or Alaska Native in the United States. Over half of this population resides in urban communities across the nation. The aim of our study was to understand smoking behaviors contributing to smoking prevalence among Indigenous North Americans in Olmsted County. Using the record linkage system of the Rochester Epidemiology Project, we identified a cohort of 898 Indigenous people to include in our retrospective cohort analysis. The inclusion of Indigenous people for this study allowed those of mixed race background. To understand if smoking behaviors differed from the non-Indigenous population, we identified an age and sex matched non-Indigenous cohort. Smoking data was reviewed with a smoking status assigned for each year of data availability for each participant to understand longitudinal smoking behaviors. Patients were categorized as never smokers, current smokers, or former smokers. The use of pharmaceutical cessation aids to aid in smoking cessation was also collected, including over-the-counter and prescription nicotine replacement products and Chantix and bupropion prescriptions. When exploring healthcare disparities, it is critical to understand the influence of social determinants of health on health behaviors and outcomes. The index we used to understand the influence of social determinants of health was the Individual Housing Index of Socioeconomic Status, also called the Houses Index. Smoking prevalence, smoking incident events, cessation events, relapse events, and uptake of pharmaceutical cessation aids were reviewed and adjusted for age, sex, and Houses Index. The key findings of our study demonstrate a smoking prevalence among the Indigenous cohort similar to national data, ranging between 39 and 47%. Although the Indigenous cohort was more likely to quit smoking and more likely to use bupropion or nicotine replacement products to quit, cessation was outpaced by a prominent relapse rate. The relapse events identified in the Indigenous cohort were 3 times higher than in the non-Indigenous cohort. These results were noted to be independent findings of socioeconomic status. Although we did not discuss with study participants possible causes of smoking relapse behaviors, prior work suggests psychosocial stress or historical trauma may be influencers of smoking relapse. Our work contrasts findings of previous studies suggesting Indigenous people are unlikely to use smoking cessation aids to quit. Additionally, smoking relapse has never been identified as a possible intervention among Indigenous people to quit smoking. Although this work is retrospective and we did not contact any participants, this represents an area that should be explored further as a method to address smoking prevalence in this population. I am proud to say this study was conducted in consultation with the Native American Community Engagement Coordinator, and our research team includes Indigenous representation. Our work was generously funded by the Robert D. and Patricia E. Curran Center for the Science of Healthcare Delivery and the Rochester Epidemiology Project. We invite you to read our article in the upcoming issue of the Mayo Clinic Proceedings in October 2022.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.